trainer. So Amanda is part of the department. She has been part of the health department. How long?
6 years now.
6 years, and was in timely. We arranged it because she actually came from Jessica's division, working specifically in lead with Anna's team. And then it has been, I know I've kept you all updated with staffing stuff and kind of our strategic planning around staffing. One of the things I've been very proud of to work on with the division leads is retention and growth and staff development within the department. And Amanda's a perfect story of that too. We did sort of steal her, I guess, from the center, from the environmental division, and she works more centrally now. And what is your title again? Resource assistant. So she is working more generally for the department, handles a lot of the fun administrative, kind of high level administrative tasks, HR liaison work, contracting stuff is in the mix for these ladies coming down the pike. And they really work hand in hand together so that we have some cross training and backup for the department as well. So eventually, I believe the plan is that Amanda would take over.
We're going to split them, so we'll go every other meeting.
Okay, well, we get both of them. So it's a pleasure. So that, just to welcome Amanda, we're glad that you're here.
Nice to meet everybody. Welcome.
Thank you.
You want us to go around and say our names so you can put a face with the list you've looked at?
Yeah.
All right, I'll start. I'm Betsy Kidder, Dr. Kidder.
I'm Volker Kron.
Oh, you know.
Oh, we're familiar with each other.
Erin Pender.
Yes, we have.
Tarek Khan, we met earlier.
Yes.
Welcome. And Rick Ketchum, we
Yeah.
first met too.
Thank you. Okay, I believe we were going to have a privilege of the floor, but that is getting postponed because they wanted a full audience.
Yes.
Okay. Is this a time where we could just briefly review what our options are during privilege of the floor? You shared something brief, I think, but you said we could, if needed, we could request an executive session if we needed to discuss something after privilege of the floor. Does that happen right then? Or
So
does it
you
happen
can-
at the end of the meeting? Or
You
how does
can
that work?
call this executive session basically at any point. So we worked with our legal counsel through the county. And it's not just at any time. There's obviously the specific requirements. If personal health records and information are shared or asked to be shared, that is a viable reason to go into executive session. And then specifically at any time that you feel as a board, you need to seek legal counsel from the county attorney, that is also a viable and legitimate reason to call an executive session.
But that doesn't mean we'd have legal counsel right then and there.
We, not right then and there, other than we would have access through the phone.
Oh,
We can call
okay.
our county attorney at any point.
And if we had a situation that happened like it did before, where somebody was sharing information with us that we really didn't have any control over, we could just limit them to the 3 minutes, tell them thank you, and
Yeah,
then
so
respond.
specifically with the privilege of the floor, there is no necessity or formal, legality that requires us to provide a response. Privilege of the floor is just an opportunity to share. So you do not have to respond there. You do not have to respond afterward, other than if you so choose to provide a formal response. And yes, so we have set a 3-minute limitation on that, and that stands.
Are we approving any minutes today or reviewing? Okay, so we're just gonna table that till the next meeting?
Yes.
If anybody had anything they wanted to change, could probably bring it up.
Yeah, I could edit
Uh-oh.
things now.
Well, did-
If anybody had anything, they were longer because you have the word for word for the.
Yeah.
I didn't have anything.
I didn't have
Never.
anything.
You weren't here for that.
Were you here for that privilege?
No. No, I
You
read
can read about it.
about it, and I read when I
There's a
heard
video as
about
well.
executive session, all I'm saying,
Yeah.
So, yeah, no, I am interested to read it. Yeah, I've been in many places where we've had to call executive sessions on a variety of boards, so. And just like that, you just have to be careful. Why why you do
the
it,
reasoning.
Mhm.
Yeah,
and
so.
list the reasons.
Yeah, so we were careful and I did send it out, for all of you to read too in terms of the specific, the other instances, of course, had to do with legalities and, potential lawsuit discussions and things like that would also qualify.
Was there something about, because that particular person was bringing up someone who was at the table by name, did that fall into
Not
any?
in this instance, it didn't. I have to look back. Let's see if I can look this up.
I mean, we all have patience, so I can just imagine if word gets out that they can come here. Talk to us about.
Only for 3 minutes.
I think you can't
other-
stop them. They can still come under the freedom of
Right.
speech. But yeah, the way you control them, give them their 3 minutes and
and say thank you and.
Right, okay, so let me see here. So, an executive session can be called for the purpose of getting advice from the county attorney. Public Officers Law 105 1F states that a public body can may conduct an executive session when discussing the medical, financial, credit, or employment history of a particular person. So.
Okay. So anybody doesn't, whether they're at the table or not. Yeah.
Right,
Okay.
yeah, so, and of course, that's just very specific, the documents, and open meetings law are much larger and more lengthy than that. And then also in regards to public comment and responding to that, if a public body such as the board does not feel inclined to answer questions or permit the public to speak or otherwise participate at its meetings, we technically don't have to provide that. We just happen to provide the opportunity to do so. So you can choose to answer questions and permit public participation, and many do so like we have. When a public body does permit the public to speak, we believe that it should do so based on reasonable rules that treat members of the public equally. So it's kind of based on the Committee on Open Government.
Oh. Any other questions on that? Figure it out when it. Okay, for new business, we can discuss agreements to settle? Okay,
Yeah, it's just me
let's do that.
presenting. You don't have to vote on anything.
Okay.
So you'll see, we have, a list of agreements to settle. There are water violations included in there as well as one body art violation. We did include the actual fines that were agreed to in the agreements to settle and paid. So there's a mix of fines in there based on some of these occurrences were for violations in 2024. So those were fined at the rate of $100 per violation. And some of the other violations you'll note have higher fine levels. And that's because they were fined or violations in 2025. So they were fined under the new schedule that you folks approved at the beginning of the year. So again, you'll see, water violations, they're sort of the same things, missing samples, failure to submit monthly reports, sort of the standard violations. And then the body art violation is a tattoo facility, and the individual had not renewed their permit. All body art permits expire in December of a year, and they have to be renewed for the artist, and the shop gets renewed every 2 years. So this individual did not renew the shop permit nor their artist permit. So we worked with them for a few months, but we got to April and enough was enough. So we took notice of violation action, fined them. They've set up a payment plan for the fine, and we are working with them on some concerns we have regarding the shop. before we're gonna issue a new permit for that facility. Any questions about anybody listed?
The, public water supply with multiple violations.
Yeah,
Second one,
yeah.
I see Village of Fredonia.
Mhm.
Is that Village Hall? I mean, it is the Village Hall address, but I know it's got the mayor. Is it water treatment plant? What are we talking about?
Yeah, I mean, it's standard samples that they should have completed.
From the plant?
From the plant, or, throughout the distribution system. There's a number of different samples that need to be
Okay.
collected.
But it's
Um,
repeat. I see, so it's been, it says multiple violations.
Well, there's two, so it's multiple violations because there's two different violations.
Okay.
It's two different samples that they
Okay.
missed. They have since taken those samples, submitted those samples. Everything was, below the appropriate safety levels. But they did miss those samples in 24.
Lunch with the mayor on Monday if I needed to.
Yeah, they've,
heavy.
they
Drink
have
water.
paid the fine, they have paid,
Yeah,
they have
that was
completed the
good.
samples. It's, so they're, at this point, they are doing the right things, but they did unfortunately miss some of those samples in 24.
And for whatever it's worth, some people here may know it's 12 days from now, they're getting the final report from the consultant about, whether they're gonna do something in the North County Water District and whatever. So there's a public presentation on that, the day after Memorial Day.
Plan, yeah.
So I guess we'll see, what happens with that.
Hmm.
I realize it's a process in Fredonia, but nonetheless, it is attempting to move forward.
Yep, yeah, I know it seems to the public that they have been sitting on their heels, but they have not been. The
Yeah.
village officials, the engineering firm have all been moving forward. Unfortunately, things take time.
Yeah.
They did that big hydraulic study of the distribution system. That's a process. That information gathering takes time, so, yeah. Was that the only? Okay.
Yes.
Okay. Yeah, so those are your agreements to settle for this month. And then, I do have a hearing officer recommendation. You're not gonna be able to vote on it today, but if anybody has any questions, I'm happy to answer any of the questions that you may have on it currently.
Is our delay in this going to delay the recommendation to revoke the license and registration of this place?
Yeah, I can't, because we can't make it official without a Board of Health order, and I can't have an order without a vote, so, yeah. Put me in a little bit of a pickle.
And it does have to be done in person. I mean, for example, we can't call other members.
I'm honestly not super aware of those requirements. I think it has to be an in-person vote. I think you folks could call a special meeting to specifically vote on something,
Yeah.
but I don't think it can just be a phone-in vote.
Yeah, it would be written in some sort of our bylaws somewhere if you've ever.
Yeah, I know,
elected to do,
because
like,
Zoom's
Zoom
not
votes
allowed
and
and all that kind of stuff,
Right,
which we've talked about before, but
We would have to give a 2-week notice to our special meeting.
and then try to get a quorum.
And you still have to have it in person for a special meeting.
Yeah, unless it's otherwise stated. There's some loophole in some bylaw somewhere that allows you to do it in some other form.
Yeah.
But we can ask about that.
I
That's
mean-
another good one to be aware of.
As a member of the media, I think all I can do is just inform the media there's having a meeting. And I don't know, you took a trade, I think it's 72 hours all you need. So you inform the media, you're having a special meeting. You can have your vote, 5 minutes and be done, but I think it has to be in person.
Yeah.
So, and you can have other locations if you announce
If you-
that. in-
Yeah, disclose the locations and things. It's the same thing.
Starbucks Lakewood.
How about Labyrinth Jamestown? What do we do then?
Would you get?
I'll compromise on that.
But every once in a while, you'll see school boards that will be at 7 o'clock in the morning.
Yeah.
Because everybody's going off to work and so they have a quick meeting and they vote on something and then they just go out their day and stuff like
Yeah.
that, so.
Yeah. Yeah,
Well, if you want to do something like that, I mean, if I needed to, I'll come to Jamestown or whatever, at 7 a.m. or I don't care, whatever. We can do it as long as it's available that day. Because I am concerned about the question you raised. I mean, if you delay it 2 months.
I mean, I don't have a lot of confidence that this individual is going to pay attention to us no matter what we do. Not to be a naysayer about it, but they haven't paid attention to their suspension. I'm not sure if they would pay attention to a revocation.
But then there's a little, do you have, I mean, is there more teeth in the game to actually do something about it if there's been a revocation?
Not really. I mean, that's our ultimate is take away the license. Yeah, and it's not really us taking away the license. It's us recommending that the state take away the license.
And the different DBAs that pop up.
Yeah.
We have talked about it, so.
Okay, well, if you feel like we need to rush things after this, you can doodle poll.
Sure. We can have a meeting, we can have a meeting at this facility.
Let's all show up.
Absolutely. That's great.
We'll be meeting at Clouds.
I think if they, the license is revoked, I mean, we can't do anything else, but, and I can't believe the state wouldn't do more if you got a business operating without a license. I mean, maybe it's not our issue.
And so this is something that we are pushing, because this is what we feel the problem is that the responsibility for enforcing this entire program lies with public health. Whereas, especially when it gets to a point of it being a facility who is selling product without an active license, it seems to me that tax and finance should be involved. Legal should be involved in some way, shape, or form. But it is a problem with, in my opinion, a problem with the way that it's laid out in public health law, that it is put in our lap.
Yeah, so what Jessica's talking about, if you remember, it's on our strategic, in our strategic plan over the next 3 years that and really I'm hoping to kind of wrap it up even or the end of this year into next year. I've talked about it before with the board, bringing forward, a set of local regulation that we could put into place, because what Jessica's referring to, and this isn't an irregular spot for the local health department to be in. We are really enforcing the state's law. It is helpful oftentimes when we have our own codes, like our own sanitary code, because it's not just enforcing somebody else's, but we actually have some proactive ability when we do our own codes and our own regulations. So that is where there has been quite a bit of success with other communities who employ local licensure laws. But then you can control the permits going out in the first place, as opposed to waiting for these things to happen and then, trying to get the teeth in it and work through the state's regulatory process of things. So there has been a lot of, and again, that's more so to ensure that the businesses on the up and up can continue to thrive because they're doing right by the community. This is really more so about reining in really kind of bad business practice and unlawful behavior in the communities.
So we're looking at potentially adding something to our sanitary code, or potentially even bringing it to county ledge, or individual municipalities can decide to pass their own ordinances or approaches to dealing with facilities.
So more to discuss. I keep bringing that up.
And it's not just Chautauqua County, it
No.
is across the state. Counties across the state are having the same frustrations.
Thank you.
That's all I got.
We're tabled for now. Tabled. All right, Lacey, you're up, it looks like.
These around for you to review and make notes on it. You need to. Good to see everybody. Sorry, I rushed in at the last minute. I said I'm going to keep this concise, keep you informed, but I really would love to reserve the time for the lead rental registry program. I can imagine you'll have some questions. Very exciting thing. I want you all to feel very engaged and informed because as we roll it out, it is a really major milestone for our community, specifically in the 14701 zip code. So I want to be sure that you all have ample time to interact with Anna about that. Some new items to make you aware of, the community health assessment and the improvement plan. This is a state mandated process that every local health department is required to perform and do and facilitate in their communities. This is one of the things that we are mandated to do that the state does not give us any funding for. So we really have to kind of leverage our own capacity, our own resources to do this well. And yet it really is meant to be the most foundational aspect of your local health department. It really builds the evidence base for the specific needs in your community. That should then inform, of course, your longer term strategic plans, where you are putting your staffing, your resources, additional resources, what revenue you're looking for outside of state funding to really kind of fill the gaps in the access areas that people are experiencing in regards to their health. So the state is employing a new process. They're right in the middle of kind of revamping what that process looks like. If you have worked clinical anything, you're in a hospital setting in particular, you're aware that hospitals are also required to do a CHHA, which is a little bit of a distinction between our CHA. Really tracking along with the very similar, aspect. It's doing a broad view assessment in your community to really understand what resources you should be providing. And they are it's an IRS requirement for hospitals. For us, it's just state DOH requirement. So state DOH has made the move to say your local health department plans should track along with the hospital plans. Imagine that. That sounds like a wonderful idea. So they moved it to the same 6-year cycle, but local health departments, because we are meant to be much more front lines and visible in the community, they are requiring that we do a 3-year kind of midpoint review and report. So we kind of just took off running with ours. The state process isn't completely solidified. It was on hold for quite a while because it's really based on the New York State prevention agenda. And the New York State prevention agenda is really driven by the state budget in a lot of ways, and the state budget was backed up and on hold. So we did not want to waste our time because, to be quite honest, the long-term, disparities and health disparities that you see in communities don't change in 3 years, and work in progress is done, but we have a really good understanding in our community of what's going on and feel very confident that we know kind of the domain areas that the state will ask us to work in. So we have gotten the ball rolling. We have a community planning team that's been assembled and they're meeting regularly. This is made up of some of our internal staff and, of course, external community partners, including all 3 hospitals, sending, their high-level administrators to the table to work together, which has been very wonderful. TCC and a variety of other community-based organizations. We employ all of the right public health strategies to ensure community agencies are at the table that really represent all of the different demographics, socioeconomic levels, and all of the different services in the community. Apart with the process, we are also required to complete a community survey. We really focus on revamping that survey and the way we disseminate that, specifically working with community groups and agencies that we know would reach a much better representative sample of our community than we have necessarily in the past. And so not only did we employ a much better strategy in that sense, we also increased our responses by an additional 300. So we're up to about 1,500 responses this year. Very clearly, as we're just kind of compiling this data, dental access issues, believe it or not, are an emerging theme that we're seeing. So I was talking again about this with our Western New York Association of Public Health Directors. It is something that they're also seeing regionally and across the state as well, but in particular kind of within the Western region. So there are a lot of other great plans that are being kicked off on kind of the more regional side of things. The Healthy Community Alliance is working on their symposium. They hold a symposium for all different Western New York health, interested agencies, and they are planning on the focus area being dental this year for that symposium. So Dr. Bender, we're going to be reaching out to you.
Great.
So to really kind of,
You came on
again,
this board just in.
Good.
but again, to bring to light, we were talking the other night at a meeting that dental health is so often not really regarded or included in the conversations when we talk about just general health. And from a public health standpoint, you cannot splice the two apart. So I'm so glad to see that there's this recognition happening on the more regional level of things. Along the lines of kind of community outreach and some of the target areas that we'll be focusing on for the Cha and Chip, the Hit the Trails and Parks program. So if you remember, we chatted with you about this last year in our first pilot year. This is now the second pilot year. It is a program that is a chronic disease prevention strategy focus to specifically increase child and family physical activity in the outdoors. So in the second year, we have already upped the ante to 10 different school districts being represented this year. Really great work in partnership with CHN. We've expanded the program in so many ways. This is just a winner across the board. I've been so delighted by this program and the staff who are working on it. The buy-in from the schools, each of the schools are kind of taking it and expanding it in their own ways and making it, work for their communities and the students and families that they have. So we'll put together, at the end of the program this year, the number of outdoor activity minutes that, were compiled just countywide because of this program. So I'm really excited about that. We included the information in our school nurse newsletter that we produce, and we're doing that really quarterly. I then also forward that newsletter to the superintendents because something, we're aware of is that the school nurses are oftentimes, not necessarily integrated into the mix of administration and faculty in a number of ways. So that's kind of one of our pushes to support the school nurses is to really then tie this back to the superintendents and make them aware of some of these opportunities as well and how it ties into their health, and was able to put together a little narrative about I'm not going to get the terminology right. Is it myopia? That's nearsightedness. Okay. Thank you, doctors. So our youngest generations are the most nearsighted in recorded history, and they're really attributing this to screen time and a lack of literally just exercising long distance vision. So I'm kind of, based on the research that we're looking at, coining the term, but don't quote me in the notes because it's probably coined somewhere else. I'll have to check it out. But the strategy and intervention is really like look up and look out. So look up from the screens and look out. That's what they're, basically saying we should be doing for children. Look out a window, look at clouds. So tying all of that into the school day and how these opportunities within the school system to do, hit the parks and hit the trails is an easy intervention that they can, help to advocate for with their student population. Lastly, in terms of the new items, federal funding. I'm glad to hear that this had come up, although not glad to share this news. We recently, I think it was probably shortly after, or maybe it was right even around the time. Did I share last time? I don't think so. It wasn't in the notes last time. We were notified by our state partners who facilitate a portion of the public health infrastructure grant that New York State formed into a fellowship program. They did an original round of this about a year and a half, 2 years ago now, and then rolled out a 2.0 version because it was so successful. In the 2.0 version, that was the first version that I was really here for, during my time here at the health department. We were able to secure 4 fellows, which are the equivalent to 4 FTEs for our department. They were assigned to projects that and I know I have talked about the fellowship program before, but assigned to projects within each of our divisions that our staff are not funded to necessarily do, but certainly support the work of that, our divisions do, and then specifically support our community members in helping to fill gaps in services. So we were notified again about a month ago that those fellows would be terminated as of May 30th. So that is a year earlier than expected. So the program was supposed to sunset June 2026. So, obviously not a wonderful scenario for these people who we were very proud to have recruited from our own community. A lot of other counties were relying on, sometimes out of state fellows in some ways, but these were local people and local students. So we were very proud of that fact. They were excellent additions to the department. The staff enjoyed having them. They enjoyed the staff. And we were glad to know that they really did gain a lot of great experience from the situation. It does leave us, though, without 4 FTEs that we were counting on for another year. So while we did not see a specific monetary cut to the department, there is a monetary cut and a people resources cut that we're experiencing. The other issue that we are experiencing, again, we aren't seeing cuts directly to our funding at this point, but what really is kind of a secondary, impact of all this is that there have been cuts, major cuts at the state health department in terms of administration and staffing. That will trickle down to our departments, in some way, shape, or form. And another, if these are staff who oversee or facilitate data systems that we utilize for our reporting, for our surveillance, other website information platforms, all of those have, become unavailable. Not all of them. Some of them have become unavailable in some way, shape, or form. So, we might not use them every day, but when we do need to use them, it's going to create more work for our staff. There are some sources of funding that, of course, we are keeping a close eye on, and we are closely linked with, or I am closely linked with the State Association of Public Health Directors. So we are certainly doing a lot of advocacy work on behalf of the funding that we all utilize. Because really, those of you who interact with the local health department know this isn't a cushy money flowing, agency by any means. The money that comes in really truly does go out to infrastructure and services in our community. So, there aren't, as much as I'd love to think that there aren't all of these high level administrative executive directors and things like that we're employing with big salaries or anything like that. This is really service driven funding. Any questions about that in terms of funding? Because I know there were some, earlier questions.
Do we know this kind of links back to the dental issues about the National Health Service Corps? Has that been cut at all?
No, that
Okay.
hasn't been touched as far as we're aware. There's been some adjustments to the Public Service Loan Forgiveness Program, which is a federal program. But it's not clear what those cuts are, and being a participant in that program, getting through to the Department of Education to get any answers is impossible. So everything's just kind of
Up in the air. Yeah, waiting.
Yes.
Okay. Otherwise, of course, reach out to me. Also, just some quick high-level updates with the pediatric dental services in particular. So I did reach out to the Fidelis contact. Thank you, Dr. Khan. I have not heard back from them directly. Allegheny, I made that director aware as well, and he did reach out to his Fidelis rep, and the answer that he received was that they're kind of in the midst of planning what something might look like, but that we certainly have coverage options available and things like, it was much more on the insurance side of things. So I'm going to continue to reach out and wait.
Yeah, it's interesting. After we met and some of the conversations I've had, it almost sounded like, and it's my impression,
Okay.
that they want to just kind of run it on their own. But it's not a great thing for the community. It has to be collaborative. They have to partner with the health departments. They have to partner with the agencies. So hopefully
Okay,
the minds will change
okay. We'll keep
at
on,
Fidelis.
on doors.
I
or
appreciate you
reaching
reaching out to
yeah.
them because it helps the kids.
Yes. We're also working with Chautauqua Health Network to explore additional funding options. Again, I'm working on some of these contingency plans, and there may, be funds that they could supply in the community for infrastructure, equipment, and things like that. Should, we have an agency that could come in and employ the dental van itself, they may be able to help leverage some funds there. So there is still really great planning going on and discussions. The other that was put on my radar is Mosaic Health. So again, working with the Allegheny director, Allegheny County is kind of in this interesting, kind of setup. The northern part of their county, Mosaic Health comes in from the Rochester area and provides basically pediatric on-site pop-up dental services. But they really aren't working in the southern part of the county because it's based on a miles distribution from Rochester. So the Allegheny director and myself are going to meet with Mosaic Health to discuss with them the option of expansion, farther into the western part of the southern tier and the base of the southern tier. So that's another stone we're turning over. And then it was suggested to also reach out to the Appalachian Regional Commission to see, what interest they have in this infrastructure. So there is great funding, as we already know, and we've kind of already knocked on those doors, had those conversations. The Western New York, what is their name? The Health Network. I can't think of the name. The funding agency for Western New York is very interested in funding something like this based on an earlier iteration that they had called Chompers. And then Rick's also provided
Well,
contacts that we've had.
Yeah, and
Oh,
the
yeah.
other one I threw out too was the Mother Cabrini Foundation.
That's who funded the,
That's who funded
The
the
UV
original
van.
version.
So
Yeah.
Pulled out
Mhm,
funding, right?
mhm.
Although it was very interesting because I can't remember, it was a conference that I was at or a meeting. Yeah, it was a conference I was at. And they were talking about different health infrastructure and sort of like mobile unit style. And they did highlight dental and they were like, and you should reach out to Mother Cabrini. They love to fund these things. And the Allegheny director and I looked at each other and we were like, oh, geez. So, but there are really there's funding out there for this.
Mhm.
It's the building the system and building it well and not just doing the
Yeah.
like quick,
Mhm.
easy
Silos,
things
yeah.
to do with silo. So, I was invited very kindly to a sort of informal dental meeting that Dr. Pender is a part of and really helps facilitate. And even there, the discussion around rebuilding the dental advisory group that we had through the health department. And there's some other, kind of working groups that could kind of plug into that as well in the dental sphere of things, because we really do just need a set of minds, kind of working on this issue. I would love to have all of the time to really do this myself. But this is another area where we just know it's a need in our community. So I'm doing what I can to make something happen, but we don't have any funding for this either.
Do you have a contact with an ARC that you're reaching out to?
So I don't in particular, but actually Jim Sherry had.
I was
told me
gonna
he
say,
would.
or Ann Battaglia over at
Oh,
Healthy
yeah.
Community Alliance.
Yeah, perfect. Okay.
She's worked with
Meeting with
ARC for years and different projects going from Bradford, Pennsylvania into Olean. So you can mention that I kind of asked you to and just touch base with Ann.
Yes. that's perfect.
Ann knows a lot of people within ARC.
Okay, great.
I
And it
think the
is,
Chautauqua Health Network is working
Yeah.
with ARC quite a
Yeah.
bit too.
Yeah.
So just other angles to.
yeah,
And they've
Yeah.
worked together,
it was actually.
HCA and CHN together in the past on projects. Yeah,
Sure.
And we do there is county representation at the ARC. But of course, it's typically elected officials and things like that, and they aren't necessarily health specific, minded, or so. Once I kind of get the background on that, I can then work with our county representatives to really advocate for this as well. So we'll hit it from all three angles would be really great.
Thank you.
Any questions there? There are some other wonderful things happening in the dental sphere of things, again, related to some of those emerging themes. So I'm looking forward to working more on that. And then just a quick update on our strategic planning in regards to staffing. Our seasonal employees really that come through Jessica's division are onboarded, and the whole idea there is to bring them on because there's a specific working season of when you can go out and really inspect wells and septics, and it can't be buried under 15 feet of snow. And food inspections, a busy season where there's an influx of food trucks and all sorts of different things. These inspectors, Jessica is really working. They're doing a great job, and there's some, a wonderful kind of hierarchy being built in that system as well. Because we're really taking a focus of being business supportive. These folks in our department have a really difficult job. They're like the ones that nobody wants to see show up at their door. And yet they're really there to protect the health and infrastructure of the community. So we're kind of flipping the script and helping the community to understand that they're really here to walk you through the process and help you manage the regulations, because we want you to be open. We want the great businesses to be open and to serve our communities and to do it well. So that's been going really well. And in order to do that, we bring on some seasonal staff to just ensure that we can get these businesses open and ready for the busy kind of tourist season. Because we understand there is a real economic piece to all of this. So we want to be really supportive of that. So we're glad to have those staff on board. And then we have really 5 current vacancies on the public health side of our department. There is the correctional health division, and that's a little different. Typically, Dr. Falk speaks to that, so I won't steal any of his thunder in that way. Tonight, he can report out on that the next time he comes. But we're at 5, which is down from 10 in March and down from 17 in January. So I'm very excited about this. I'm not tracking it in detail by any means. Again, I attribute so much of this to the work that Hannah and Amanda are doing, where we really got to centralize this division and focus on a strategic plan. So, I say all the time, our division leads, the staff in our departments are so proficient in the content expertise. They are so excellent at what they do that it really doesn't leave much room for me to need to do any of that type of work. It really frees me up to do, really focus on these gap areas, how we build in some of these other programs and services, and then really work on the strategic planning for the department so that we're really serving our community well. There's so much more that we can be doing. Of course, that all is reliant on revenue, capacity, the resources that we have. So building in some of the staff to support that work, it's clear. As we've built them in, it's helped so much just in our recruitment, our retention, time on task with, the HR and civil service processes that, we get to work through in government and public service. So I'm really proud of the fact that we're working really diligently to make this a great place to work so that we retain the best professionals to do the best work in our community. So very happy to share that with all of you. Any questions?
I went to the 60th anniversary celebration, and I had a chance to talk with Teresa Miller about her immunization efforts in the Amish communities. She grew up in Amish communities in Ohio, so she kind of knows that community, and she has most success in the climber Amish. That's the same Amish that have the solar panels on their roofs. Anyways, I was just curious, have you had any measles cases in Chautauqua? Not yet.
No.
Okay.
And I will say, as a follow-up, because that was a big topic that, I reported on last time. I think I did email you all, but it's just always worth bringing up wins for our staff in the department and the community. We really quickly put together, but very strategically planned a pop-up immunization and vaccine pod in an area of the county that typically has some of the lowest vaccination rates, and also typically has a, a marginalized community that typically does not access, these types of services. We really planned the messaging with the stakeholders, not only in mind, but actually utilizing the input of Amish moms in reviewing the messaging that we used. We focused on a very pro-protective, you're here, this is things that you can do to protect your children and your families, as opposed to the more kind of scientific, data-driven messaging about, death and mortality and, all of that. We worked with finding out who the stakeholders and the real champions in their communities were, from drivers, English drivers who help transport, families back and forth, to the bishops in the church, and utilizing Teresa's relationship because she's built so much trust there. And along with that, the other staff members who are coming along with Teresa now have gained clout and trust. So we held a 2-hour pop-up clinic in one of their kind of like a co-located spot where they often do, I think they actually do like a little produce auction there, or it's something. The Amish often bring their produce to this volunteer fire station anyway, so it was a familiar location. We served over 30 families in that 2-hour time span, which was the most served in, an amount of time in years there. So the staff is doing an excellent job in getting these things out. And specifically, it was MMR, vaccination that we're providing. So yeah, we're really glad. It's actually, we're getting calls from other counties now. So
Hey.
you do a great job, and then, you're asked to help others, which is wonderful. But
You go back a month later for
yeah,
the second one?
yeah,
Is that
so
what you
that's
guys did?
actually coming up here in the next couple weeks.
Mhm.
And then they'll actually, most likely, based on some of the feedback that they're going to ask for at this next pod, we'll probably make that a continuing pod like they have in Clymer. It's invaluable. We talk about this on kind of the other side of the aisle with the public health emergency preparedness aspect, to keep consistent open lines of communication with communities specifically that typically don't interact with digital media and things like that. In times of emergency and real emergency evacuation, things like, to have those lines of communication open are invaluable to saving lives and ensuring, a great systematic effort is made. So we'll keep that open to keep those lines of communication open.
I spoke with Marcia Clark, who came
Yes.
to our last meeting. And I just picked her brain a little bit, and she said an interesting thing they found in the past was some of their success with like the old order Amish communities was just going straight to the door.
Yeah.
And because the parents were more likely to say yes because other people weren't around. Yeah.
Yeah.
That takes a lot of effort to do, but she's like, that was our only way to really infiltrate.
Yes.
We need to truck her a little like Care 2 kit around to each Amish family then.
So, yeah.
Get to that.
Yeah, we're trying to, right? I mean, just throwing it out there.
Well, and start going to the pods and familiar face, and then and there's actually a really great story of an Amish mom who has turned English, who has now then been visiting our clinic for other services as well. And so really this is kind of her bridge, a very safe bridge in place for her into the modern medical system and health access and clinic systems. And so she has been invaluable too in helping to inform us of, how to best reach out to the Amish community and what the moms are feeling. You wanted to say something?
I was just gonna say, in keeping with this idea, it also means that our mobile health unit is back on the road for spring, summer
Yes.
of
Good,
25.
busy. The busy season is upon us for everything. So of course, reach out to me anytime, questions, thoughts, ideas. I'm always happy to hear from you. And with that, I'm all set.
Thank you.
Now for the real
We're gonna
presentation.
fire a little bit. I've been having a lot of trouble with technology and bandwidth this evening.
Driving for
So
this?
we are
I
going
can drive.
to do a double computer where I'm gonna keep the YouTube live going here.
Oh, I guess you could just use yours.
Yes, and if you want, however you'd like to, just come on, flip this in. We'll get this on the big screen for you. Hopefully. You guys don't want me to stand up and in front of everybody, I guess.
The monitor is not.
Yeah,
working.
why don't you,
Oh, there we go.
actually, I'll switch with you.
Okay.
So
Do you
then you
want?
can sit or stand. whatever you want.
Yeah, I'll stand. I've been sitting enough. Stretch my legs.
And it should, hopefully.
There
There we go. So if you wanna, and if you can drive, so there you go.
Yep.
Perfect. I'm
Yep.
gonna share, I'm gonna share on the
Good.
YouTube live, so I'll be.
Excellent. So, as I've introduced myself before, I'm Anna Powell, Senior Public Health Sanitarian for our department. Jessica's here to try and keep me on task. I go off on tangents regularly, so but we'll get started. I
We should
know.
caveat that by saying, because Anna is so passionate about this topic. If you not
Passionate's
talk to
nice.
her
That's a
about it,
nice way to
no,
put
it
it.
is. We are very lucky community to have.
And to preface, as we go through, sometimes we fall victim to being lost in our own world of programmatic things. So if you need clarification on something, please ask.
Yes, absolutely. Most of this stuff we talked about at the 60th anniversary meeting, but obviously lead poisoning is a huge issue in our community. We have very old housing stock. This exhibits in children under the age of 6 because they're developing and their bodies are little and they absorb lead very, very quickly. So lead poisoning harms growth, development, ability to learn, cognitive function, pretty much every system in the body. I actually learned yesterday, I was at a conference, already off on tangent number 1. I learned, and this is going to dental, so you'll appreciate this, but chronic exposure in children and adults can create like lead lines in their teeth and gums, and I did not know that. So I learned something new yesterday. Learning disabilities, special education, all of those things exhibit in children that have been lead poisoned. There's no safe level of lead in the child's body. The CDC blood reference value is 3.5. Our level here in New York City is 5 and above micrograms per deciliter. So our action level is called when we're testing above 5 in kiddos. Go ahead. Again, like I said, our lead hazards that we face here in Chautauqua County, it's lead-based paint. We have very old housing stock. We have very deteriorated old housing stock. And over 85% of our housing stock was built before 1978, and that is when lead-based paint was banned. Our areas that we really focus on or are high friction impact surfaces. So moving windows, perfect time of year where we start to see kids' levels go up. How come? Everybody starts opening their windows, kiddos are sitting at the windowsills, and it creates a really fine lead dust. Kiddos put their hands on the windowsill or on the floor, put their hands in their mouth, and they're lead poisoned. It's really as simple as that. A good visual I always like to think about is if you took a sugar packet and took 4 grains of sugar out of that sugar packet, that's enough to poison a child. So we're talking very minimal amounts of lead to poison children. There are some other sources. Every now and again, we had the applesauce situation. I think in 2024, there was lead found in cinnamon. So we are always looking at recalls in food. Most of the time it's spices and cosmetics. These are things that are usually coming from out of country. We don't see it a lot, but as we have more refugee families coming in, we have had to work with a few of those families. Most of them weren't poisoned here, but we still assist and help those families and educate those families. We actually had a Swahili family, so that was a first for us and a great cultural experience for us and our team. There's obviously always lead in drinking water. We just really don't see that here. It's definitely not like a Flint, Flint, Michigan. I think that gets all the clout when we're talking about lead poisoning. But our public water supplies, thanks to our team, Natalie, they do an amazing job, and the regulations there for testing. We have testing in school drinking water too. The state had started that program about 5 years ago, 6 years ago, I think. So that being said, we're really focused on housing here. Kind of becoming a housing professional. I didn't expect that, and coming to work for environmental health, but housing is now where I'm at. So go ahead. Oh, you already did. Okay, sorry. They kind of look the same. So our lead programs for the health department, these are a response or intervention. We obviously have to go in above that level of 5. We do an environmental assessment. We have a nurse on staff. She is able to do developmental assessments. We also really try to work more with the pediatricians to see if they have noticed any developmental delays or have anything on record for these children. We go in with an XRF. I was supposed to bring that today, but Marty's not here. So
Yeah, XRF define.
yes, so XRF is X-ray fluorescence analyzer. So it is pretty much like a little snub-nosed little gun that we can put on a painted surface. We pull the trigger and it's able to give us a reading of what lead-based paint is in that painted surface. So we're able to test homes where we're not destroying any surfaces. We don't have to like scrape paint chips off and send them off to the lab. We're getting real-time readings, and we can give people hazards in their home pretty much instantly. So we are always trying to reduce the hazards in homes immediately. We're really working with families on wet cleaning, making sure they're washing hands, nutritional information for the kids. We want kids eating diets that are rich in calcium, vitamin D, and iron. And then all of the kids in New York State should be tested at 1 and 2. And then all of the subsequent follow-up testing that has to occur once we have an elevated level. Again, we work really closely with nursing and our early intervention team. Every child that comes to us that has a level over 5 is given an automatic referral to our early intervention team. They can assist with developmental assessments if our nurses are backed up. Then also they get a referral to our SHIN program. And the SHIN,
Children and youth with special healthcare needs.
thank you. And then what that really does and where that program shines is that program's allowed to follow these kids until they're 21. So when we're talking about long-term health effects and cognitive and behavioral damage that's done to a lead poisoned child, being able to have these supportive programs to follow these kids throughout their entire childhood is invaluable. That's really where we need to be supporting these kids, is once they're in school age.
Anna, can I just add too? So the relationship that they've built intradepartmentally is really a kind of cornerstone now in the state. So that referral was not happening everywhere. The state either just did or is looking at requiring that a qualified lead level is an automatic referral and qualifier for early intervention services. So this team was really ahead of the curve in that. I think that's something I'm glad about.
There's a question just for my own edification.
Yeah, absolutely.
If a child had an elevated level
Mhm.
and somehow can get the child out of that situation, or that gets remediated or something, will that lead eventually leach out? So would that,
Yes.
can they overcome it? I mean, they may have some developmental disabilities early on.
So we can get the lead levels down in children by obviously doing that nutritional outreach, having them kind of supplement multivitamins, sometimes an iron supplement. I mean, Dr. Khan, you could probably jump in here as well, more effective than I can. But your body will, that's kind of crazy. So number one, your body will store lead in your bones. So if you want your mind blown for a minute.
The elemental
Your-
biochemistry of it basically is literally at the atomic
Like
level.
kind of,
the
yeah,
charges
like
Yeah.
calcium, right?
combine.
So it will mimic calcium and it will be stored in your bones. So say we have a small young female child that's elevated for however amount of time, but she has lead stored in her bones, then as an adult,
You can
she
still
gets
see it.
pregnant and is carrying a child, that lead can leach out of her body, become active again in her bloodstream and poison that child in utero. So the child is already born lead poisoned, right? So I mean, to me, that's,
So the blood
That's
levels
just
can come
wild.
down, but your body can still keep it stored in your bones.
right.
And-
There are
the-
medical
The,
interventions. for
yeah, the
chelation.
levels where you see the lead lines in teeth and bones, we're talking really high lead levels. Most of the kids that we see in the community are 6 or 7 or 8 or 9. And the effective program and following
Yeah.
those
Right.
kids, usually you don't, if the mitigation occurs, placement in a lead-free environment occurs, you don't see lead lines and long-term problems. So for
Right.
lead lines to occur, you're talking about someone with a lead level of 15, 16, 17 over an extended period of time. So I'm hoping, and fortunately, because we don't see that high lead levels, that we don't have very many people with lead lines. But again, person to person, it can vary.
Yeah, it really can. I mean, there can be a child that eats a paint chip is a 45. We get that lead level down right away.
Yeah.
And they really show no subsequent effects. But then there could be a child that's a 5,
Yeah.
that's chronically exposed as a 5, and then they have, lifelong learning disabilities and the behavioral issues. So it's, I don't know, it's pretty crazy stuff. Again, tangent number 2.
In the very extreme cases too, when we get the really high numbers, the kids get sent to children's to do chelation
Yeah,
to actually clean the blood as quickly
chelation.
as possible.
Yeah.
Is the threshold for chelation
Yes, 45.
45?
Yeah, and how many did we send in the last year? It's
So we do not
From the county.
see,
Yeah,
yeah,
because
we
we
do
haven't
not
seen
see
one
a
in a-
lot of levels that high.
Yeah.
I think we generally have about 1 or 2 a year
I was gonna say 2.
that are,
yeah,
yeah.
that's
So luckily we don't have those really high levels, but I guess what really concerns me is still those really low chronic exposures can be just as equally detrimental to a child.
And from the standpoint of why we are considered a community of concern is because there are counties of kind of equal structure, demographics, equal size, that you don't see nearly any of these numbers at all. So that's sort of the fact here too. For some context, Dr. Khan was referring to, there has been a really great system built here within the county, partnerships with the pediatricians, with school nurses and families, the health department. So much so actually that I remember the outreach that the health department did. Now this was years ago, having children living in an older home in the city of Jamestown. and got the information about awareness. I'm in public health and, a health consultant at this point, and I'm like, oh my goodness, yes, I need to do this. I happen to have a very lovely pediatrics office who just happened to be on the ball and did the right testing at the right times. And, everything was coming together. I did call to see what programs were available because I was certain that, knowing the age of our home, that we probably had this in our home. And I wanted to ensure that lead levels weren't going to increase for our children. At that point, there were no intervention or mitigation strategies in the community. So this continues to build and build and build in this framework and patchwork of systems coming together of the right screening, the right, awareness building. And now we're finally at the point where we have these really great intervention strategies coming to play.
You had mentioned that your focus is mostly on paint, but the BPU is doing this lead pipe analysis.
Federal.
So
Check
that's a New York State.
So, yeah, it's
Yeah.
in New York State and it's really a federal push too. Again, a lot of that Flint, Michigan stuff has spurred this, and there are definitely lead service lines out there. That's absolutely a true statement. But again, if those public water supplies are conditioning their water the way that they are supposed to be, and the folks who are monitoring water are monitoring and sampling and doing all of the right things, lead should not be an issue coming out of your public water supply.
Well, my sense was that BPU was trying to just do like an inventory who had the lead pipes.
And that's a New York State requirement. So all community systems, from big systems like BPU down to mobile home parks, were all required to do an inventory. And part of that is New York State trying to gather information and data about what
The extent.
the extent of it is and what the potential costs of this sort of real true lead pipe remediation would be. Yeah.
Another
Vying for the
testament.
federal dollars, vying for the federal
Yes.
dollars.
Yeah, building the case. Another testament to the community though, because I know in particular the BPU is very ahead of the game and forward, progress that was made.
But I mean, a lot of the community water supplies have done those lead service
Same.
lines. Yeah, I mean, it's required.
Yeah.
Okay.
Yeah. BPU did it very effectively, so I'm not trying to
For being
take
a large
credit away from them.
system.
They did do it very effectively. But they didn't really do it because they wanted to. They did it because.
Yeah.
Thank you.
You're welcome.
So, getting back to our programs here at the Chautauqua County Health Department, we do have a prevention aspect to our programs where we outreach to the cities of Jamestown and Dunkirk with newborn letters. So all newborns that are born and reside in those zip codes will receive a letter from us. We can go in, we can do a free inspection. We offer inspections, training, paint supplies, and we also have some grant funding available to do complete remediations in homes. For the most part, these programs have always focused around children under the age of 6, and that's where we're always focusing our time and effort. If there's child care, grandma's watches the kiddo 3 days a week, we're there. Any expecting parent, we can do inspections there as well. And then if the property is a rental unit. So most of the time, we don't have landlords knocking down our door to say, hey, come and inspect our apartment so we can do all the work and make sure it's lead safe. So we really rely on tenants to get us into those rental units.
Right.
And so this is really where our New York State DOH program, the lead rental registry program, comes into play. This is the most proactive ordinance that has come out in, I think, any state in the country that will implement mandated inspections in rental units in communities of concern throughout our state. our community of concern is Jamestown, the 14701 zip code. So that will hit some other communities. They base this on, again, incidences of reported elevated blood levels and age of housing, of course. The city of Rochester, what did we say that they were already doing? Like, we should all just want to be like Rochester. So years ago, Rochester implemented a lead ordinance into their city code. They've been doing this for years and have saw an 85% decrease in lead poisoning in children in the city of Rochester. So the state has really kind of mimicked their program and are going to address these high communities of concern throughout New York State. They also have encouraged us to kind of pick a model of what is going to work for our department. Being that we're kind of smaller, rural, we don't have a lot of third-party inspectors. We don't have a lot of huge environmental firms here. This really is a program that we need to implement and fill that gap until hopefully this regulation picks up and a ton of new businesses can pop up out of that. Yep, so public health law, I won't go into all of that, but at this point in time, they have sent draft regulations out for public comment. Many community organizations, our coalition, have responded to that, and throughout the entire state, they have taken all of that information. They actually have to do another draft and release to public comment. So we don't have those yet. But hopefully maybe this fall or by the end of the year, all of those will be finalized. The state is also providing us with a software system that will allow us to identify rental units and kind of build out a workflow process to hopefully make it a little bit more efficient for our department to run this program. You'll see why in the numbers in a few minutes. Again, I said our community of concern is Jamestown and the surrounding areas. Approximately 5,000 properties. So again, community of concern is Jamestown. Not only do they have old housing stock, but over 50% of the ownership in Jamestown is rental units. That's huge. That's a very large portion of homes. And a lot of them are only owned by a few people, which is even scarier. So our property criteria is rental properties with 2 units or more built before 1980. These properties will need to be inspected every 3 years, and our department will issue them a lead safe certificate. Our inspection services will include XRF inspections, but at a minimal, the state is requiring us to do a visual and dust wipe sampling. And then again, the lead safe certificate that we'll issue.
So we are anticipating that our staff will be doing the large majority of these inspections. There is the option for third parties to come in and do inspections, but even if they do that, we are required by that public health law to audit the third party inspectors to ensure that they're doing the best.
Yeah. And are these criteria that you've put up there, are they from Rochester or these are just
No,
more?
this is the state program
State
that
program.
is built by New York State DOH. This is the criteria they have given us.
So is this required to be able to rent a property then? Is there like?
So there's the potential for us to work with code enforcement to ensure that, you know, And we are already working with Jamestown Code
Yeah.
Enforcement very closely because Jamestown is building their own rental registry with their own requirements about what they
Not
think.
specific to lead.
Right.
But for other issues, yeah.
So we're working in collaboration very much with them, and they can consider these, sort of state of lead safe certificates as they're considering certificates of occupancy and those different things.
So this is our current inspection load for our health department for the past few years. So round about 150 inspections a year. So with that 5,000 number, we're looking at increasing that to potentially 1,600 or 1,700 inspections a year. That is quite substantial. We have staff, we already have a slide on staff. Look at that, it's right there. So we have obviously increased our capacity just in our lead and housing programs. I think we may have filled out a good portion of that filled positions on our directors, our directors report there. So again, we have senior public health sanitarian, myself. We have a few other public health sanitarians that will help with some overview of each of our programs. We're adding on 3 more public health technicians, another operations assistant, community services worker. Through a lot of feedback and working with the Homeless Coalition, having a community services worker and somebody that's knows our community and that's trusted in the community and can go out and help bridge the gap for our inspectors. Sometimes it feels like our inspectors do a lot of social work things as well. So to have that support system on our team, to be able to grab that case and say, hey, there's lead hazards here, they need a grant program, they don't have a computer, they don't have a car, they don't, there's so many gaps that our families experience. So for somebody to go out with a scanner in their computer and say, hey, let's get all this filled out and submit it over to COI, and then they have everything, their application's done. We can look up their income and help them with their logins and things like that. This is really such a gap that we find, because you can tell somebody, oh, just call this number, get your application, and then it's kind of like there's no support after that. They're kind of left to the wind, and some people really need that care and support through the whole process and reassurance that we're here to help. And so is COI, working between agencies, can get little hairy. So that community services worker, I'm really excited about that position. We have a nurse on staff. I'm devastated about losing Rita, because she is our public health fellow, and she is so young and bright and brings so much to the table for us. But she'll land on her feet and all good things will come to her. So that's kind of our staffing structure at this point. Just bringing on a bunch of staff to really have to man this beast. So our current funding is a little under $1 million per year between rental registry and our lead poisoning prevention program, grant, CLIP, call it CLIP Plus. This really covers staff time, mileage, training, inspection and supplies that we need, our XRF maintenance. But most of all, it really gives us the ability to, when we have an elevated kid, we can take a whole bag full of cleaning supplies with us, Swiffers, garbage bags, gloves,
Plastic shoes.
Well, we do that as well. So we also have whole paint packages. We can give people 4 gallons of primer, scrapers, plastic, paint brushes, things that they need to make some remediations in their home. After proper training, of course.
Sorry, were you done?
No, lead safe work practices, that kind of ties into that, is we also have a budget, a pretty big budget for training. We want to make sure that people that are doing lead remediation work are properly trained. And sometimes we think about, oh, well, I could call so-and-so down the road. He could put 4 new windows in for me for $400, right? And then just as soon as you tap, add the lead-based paint issue on top of it, it doubles. Why does it double? Our contractors have so much training. They have 4 days, their workers have 2 days, another RRP session. So these guys and gals are really going through a lot of extensive training to be sure when they're going into homes for our families, they're doing it lead safe. They're not further poisoning the kids, and they're cleaning up properly afterwards. So that's where, and that also takes a lot of plastic and a lot of supplies, and it's expensive to do it right. And we make sure that we offer them that support and training, reimbursement for certificates, and just kind of give them a leg up, because again, there's not a lot of huge environmental companies here. These are smaller contracting firms. We kind of recruit,
And it is local workforce development
It
that
is.
we're talking about. I mean, some of these contractor jobs are good jobs.
Yeah.
We're creating, business opportunity in the community as well.
And
Yeah.
improving housing at
Yeah.
the same time.
My favorite story, so full circle, I'll do one more tangent. We actually worked with a family. They had a lead poisoned child. Mom was amazing. Dad is amazing. Dad does some painting work on the side. Ends up working for one of our lead abatement contractors through our HUD grant. Works for him for a year, gets a ton of experience, gets his own certifications, and now he has his own business. And he's just amazing, does amazing work. Every house he's in, it's grade A work. So it's, a lot of these people really care about what's going on, understand what's going on in our community. And that one just kind of hit me really hard, because it was just like full circle, just awesome.
So I'm going to preface the next slides here because, so we have talked about all of the great work that we're doing currently and the great work that we are expecting to do under this lead rental registry. And we gave you a little hint of the funding that, again, with that $366,000, we're doing roughly 150 inspections per year. And now we are going to be asked to do 1,600 plus inspections a year. That math doesn't fraction the same with those grants. So as we're moving forward with this rental registry, we're considering how to ensure that we have the funding internally that we need to sustain this program and sustain all of this good work that we will be doing in the future.
Yeah, I actually just did some math on 1,600 inspections a year at 8 dust wipes per unit. It's like 12,000 dust wipes, and that equals out to like $55,000 a year just in dust wipes to send to our lab. So this comes in of now charging a fee for our lead work and our inspections for rental registry. Kind of looking at a tiered approach, encouraging landlords to get their properties inspected sooner rather than later. So if we have the, where's all my?
It's on the next slide.
Oh, okay. So
This is your
tiered approach.
introductory
We're looking at tiered approach here. So if we've been in a unit in the past 5 years, we go in, we do that visual, we take some dust wipes, and then we can charge less amount of money. We're in there less time. And then, but if we don't have an inspection, we're gonna go in with the XRF, do a full inspection and make sure we're really thorough. That cost would also include their dust wipe clearance level at the end, once they have completed remediations. So we're kind of looking at this fee structure. I pulled, again, I said we've been working very closely with the city of Jamestown. At this point, they're paying a third party between $600 and $800 per inspection. Then they're also paying on top of that $375 for a clearance.
What is
So
clearance mean?
The clearance is when you go in with the dust wipes and actually make sure that visually everything looks good, and then we take wipes and wipe surfaces. Those wipes get sent to labs to be analyzed so that they can actually make sure that there's not lead dust hanging
What's
out in
the
homes
final
still.
you've passed for that inspection?
And the city's paying that third party.
Yes.
or currently for their grant programs, because they do address lead in all of their, home programs, rehab programs, they do address that. I have never ordered a third-party lead inspection for myself or here, obviously. So I really wanted an accurate price of what a landlord is gonna pay if they're like, oh, we don't want the county in there. We're gonna hire somebody else to do it. Well, go ahead. Be my guest. So while we're trying to be very fair and affordable, cover our costs, so we can still continue to offer the cleaning packages, we can still offer construction packages. Because our grant money from the state is, we need staff to do this work, and that eats it up really quick.
And so that grant money that we have for the lead rental registry, the current contract that we have for that grant takes us through March of 29. But we all know what can happen to grant money.
What's the incentive for the landlord to do this?
They have to, it's public health law. So what's gonna happen, you guys will be potentially very involved in the future of this program. Because
We're gonna
Getting-
get thick packets here, aren't we?
Yeah, those packets, yeah, you guys will get sick
So,
of seeing me.
and that's part of what we're considering, with the fees, is we don't want to make this program ridiculously expensive for anybody, but at the same time, it's public health law, we have to implement it. The option could be, use us, we'll try to give you a bargain basement deal here. You have other options to do third party. So we're trying to make something that's reasonable, to consider our costs, but to also, because it's also going to be, once we find hazards, they're gonna have to fix them. And
Is
that's
that
gonna
too
be-
reasonable? Is that too reasonable of a
Well,
cost?
we'll-
That's what I'm looking at.
Yeah, Jessica's already thrown that out to me already.
If you all do propose to include this in an iteration of the sanitary code, you would have full purview to set an increase.
And so I have some prices broken down. And this being said too, right, we want to charge a fee, but a lot of the narrative when we're dealing with particularly difficult landlords right now, and not just right now, for the past 5 years that I've run these programs is, well, I don't rent to kids, so I don't have to do anything.
Right, so that's.
So now this rental registry, it doesn't matter if there's kids in the units, they have to be inspected. So this is kind of our breakdown of our costs.
I have a quick question though.
Yeah.
So what if they don't, I know it's public health law, and they don't do this, and then what can we do?
So
So you said they're working with the code enforcers and certificate of occupancy.
So
stuff.
that's it. I mean, but this is also why I've been talking about the idea of making our violations mean more, getting them registered at the county clerk's office, making these sorts of things potentially part of a deed transfer requirement, and putting some of these extra steps in place so that I don't have to bring you folks 57 stacks of
I mean,
paper.
because under public health law, for when we put a property under notice and demand, at this point in time, public health law states that we can fine property owners $2,500 per day per violation.
Notice and demand means we've been in the
Yes.
property and identified lead hazards.
And we have conditions
Communicated.
conducive to lead poisoning.
And I'm just gonna continue on, if they don't pay that, then what happens?
I mean, there
are authorities
Things
under
to think
public
about.
health
Is it
law.
like
It's
we just talked
extreme.
about?
That's what I'm worried about.
Yeah.
We need to think about all of that before.
Right,
Because it could
so,
be tax, particularly you said there's a relatively few number of landlords
Right.
in that zip code. So, I mean,
Right.
so it looks like this, but if you got
You can
1,000
get the
rental
property.
units or 300, it's.
right. So what I have really tried to implement and build our relationship with our landlords, some of our most pain in the butts, they don't really mind us, right? So what I've really tried to implement with them is a flexible work plan, right? So we're more interactive with them. We've developed a work plan for them based upon hazard levels, right? Because for 15 years, we used to just allow them to repaint surfaces. What happens if you repaint a window and you open it 4 times?
Expose it.
We're right back to square one, right? So that occurred for 15 years. October 2019, beginning of 2020, we were like, okay, this can't happen anymore. We need to fully remediate friction and impact surfaces. That's what's poisoning our kids. So they have the choice. They can remove them, strip the paint. We do a spot check, and then they can repaint them. Or they can just replace the window, right?
So the inspection cost pales next to the mitigation cost. Which is
Correct.
what happens next
That's
to
the
them.
incentive, yes.
Well, yeah, but I
Yeah.
mean,
So.
it's still a high chance that they could fail, and then they've got a big bill on their hands.
Yes. Well, and like I said, we do a flexible work plan with them, and as long as they're complying with us, dates, you know, hey, let's do these 3 windows, they're in the kids' room, take care of the floor, we're gonna get kids' rooms safe, work with the families to clean the homes. This has gotten us more success than fining them ever will, and I understand that. So this is why we've started with this flexible work plan implementation within our programs and with our inspectors, instead of just sending them all $100 fines that they're not going to care about. And also, when I bring somebody here and I want them fined, I want them fined $2,500 per day per violation, because we've already given them the chance to have a flexible work plan.
So we're working on county legal
Yeah.
with regard to the rental registry. We're working with county legal, and beyond that, the state has recognized that enforcement of this rental registry is going to be a lot to ask of county health departments. And so they're working on providing guidance directly to our county legal as well.
Will we come through like the hearings?
It's gonna, yeah, it'll
now,
be through
where
you.
there's a recommendation.
The $2,500 a day seems to exceed the value of the home pretty quick.
And so to this point, I
So
wanted
we
to add,
need to make it cheaper for them to fix the house than to pay the fine.
so one quick thing, well, 2 quick things I'll add. So in regards to the point about the value of the homes and then the expense of the work, because this is going to come up. This is what you all ask these questions, and same thing for our elected officials. We've been, kind of walking them through what all of this looks like and all of this means. Typically, the homes that we're seeing this in, and this is kind of a generalized statement, although backed up very much so by, our staff who go in and see these. Oftentimes, these are homes where there have not been major investments made in the structure of these homes for many years. So it's not just, a few old windows because, so-and-so who's 85 years old has lived there and her income is now fixed and, these are different scenarios in which we're also seeing numerous other health hazards in addition to lead paint in terms of literally,
It's
asthma, air
huge.
quality,
Yeah.
Infestation.
infestations,
Yes.
the structures of the homes. So it is sort of a means of
Urban renewal?
urban renewal and
Condemning.
sort of pushing, this matter that we need better housing. That's not a secret in our communities, and it's all over from economic and development assessments that they've done to our health assessments. So there we go.
No, this is just that one zip code right now.
Just one zip code. Right?
For the specific lead rental registry.
Yes.
In regards to, you know, where some of the teeth come from as well, there are authorities given to local health officials through public health law in regards to condemning properties, what that looks like and what triggers, you know, us to lawfully do that and to do that fairly and well. You really need great stepwise regulation to lead you there. That's sort of been missing. That's been a gap in how we do things in our communities. And so local health officials would be not, you know, very much willing to jump from, hey, you have some water violations here, to your home's being condemned, you know. So to have these sort of programs in the mix that show there's clear degradation of these properties, clear exposure of children to harmful substances, that gives us basically the case to make, where then we can eventually go in and say, this is so clearly an abuse of, you know, regulation and an unlawfulness here that we could employ other legal strategies.
So there's also another potential, and we'll talk with legal about that, but just to bring it up here so you guys are informed, there's something called the Spiegel Act. And what that allows us to do and enforce is to withhold rent from a landlord that has not been compliant and still continues to rent a house that has conditions conducive to lead poisoning. So that's like receiving DSS money, right? So many landlords are getting Section 8 or DSS and getting paid directly from our programs to rent houses that are poisoning the kids that are in them. So
Is there investment from Jamestown to get ahead of this and build new housing where these people can be
Let's
moved
advocate
to?
for that.
I did that Second Street.
So actually there's a lead safe house in Syracuse, and myself, Crystal Surdick, Gina Parody from Land Bank, Amanda Straight from COI. We're actually kind of having like a little informal meeting about what it would look like to create some infill housing to where we could actually remove kids from homes. We know there's homeless issue right now.
For the record, when we
So-
say remove, during
Remediation.
remediation,
Right.
to
Right.
house them separately of the poisonous structure.
Right,
Not like
so
removing.
until their unit is made lead safe, we could actually have a spot for them to go. It's just kind of a brainchild. We saw Syracuse has one coming up, and that would really be beneficial for us because with our HUD grants, this will be a little bit later, but with our HUD grant, we actually relocate families and we have to make that home lead safe in 10 days. So our contractors are under the gun to get that home done, windows done, doors done, floors, stairs done, everything painted in 10 days. And that's how long we're able to fund a family to be relocated. And we do that on a monthly basis. So what that would provide is having a home for them that's managed by one of our agencies. We spent our last grant period, we spent about $100,000 relocating families.
It's kind of like based on the Ronald McDonald House model.
Right.
Oh, yeah.
But
We're
to get-
anticipating a lot of these houses could be shut down permanently.
Well, so
That's not ever the goal. Our goal is never to placard or condemn a house for our current programs. We do not condemn or placard a house. Like, we don't condemn, we placard. I don't know if there's a difference there, but we do placard once it becomes vacant. right? So we aren't just kicking families out of their homes and then placarding them. If you ever see a placard of ours, it is because that family has left. And then we don't allow anyone to move back into that until lead hazards have been remediated.
To that point, though, Jamestown does have their more comprehensive registry. So, ours is in particular to lead. So there could very well be these same homes that there might be other multiple issues in. And Jamestown would have the purview, as with anything with code, as long as it doesn't circumvent our, preemptive authority, they can certainly add in additional levels of regulation and authority. So they could potentially be shutting down more homes or.
But also a lot of grant programs overlap because you think about different weatherization programs. What are those programs doing? They're replacing windows. So a lot of these sort of program efforts in
together.
like home remediation and home improvements and, making your community more affordable, they overlap with the same lead issues that we're talking about.
So again, this is kind of our breakdown of our high level, you need the most out of your inspection. So that would allow us to cover some inspector costs, travel costs, our clerical staff and office time, potential enforcement, because we know that's going to happen. Our dust wipe costs, this is our current price per wipe at our current contract with Accurate Analytical. We are in the process of getting a new contract and a new RFP out. So like anything else, I would anticipate that level to go up a little bit. When we do go in and clear a home, we're taking a minimum of 8 dust wipes. So we're doing at least 4 rooms in that house, more if necessary. So this is really that bare minimum cost for a clearance sample or a clearance inspection. Again, we have inspection costs. We have to wear a pair of gloves for each sample, a template, a floor template for each floor sample, and then XRF maintenance. Those are about every 12 to 18 months. We have to send them out to get resourced because they do run off of a radioactive source that does decay over time.
But does not expose people to radiation while we're using it.
It does not or expose anybody to radiation.
So we did a bare bones, what we think at minimum our staffing and supply cost is going to be. So this is the tier 1 inspection with that range of the 191 to 221. And if we go back, what we're proposing for those tier 1 inspections, would be the 150 to 200 range for an original unit, and then any additional units in that home. Ideally, we would be doing all the units on the same day and saving on some travel and different things. So we would be charging a lesser amount per unit if we're able to do it that way.
So I do want to highlight here of incentivizing landlords that do rent homes to children. Like I said, there's that narrative around the landlords that don't rent to kids because everybody knows that Jamestown has a problem with lead-based paint. It's been a problem for years, but then you talk to them again and out the other side of their mouth, they're like, I didn't know my house had lead-based paint, right? So we're incentivizing those landlords under our grant programs that if there is a child under the age of 6, this inspection will be covered at no cost.
So a passing inspection, all 8 wipes are negative.
They are below the allowable threshold.
Got it. But every single one has to be.
Correct. Yes. And then this is where that reinspection comes in. So say we go in, we take 8 dust wipe samples, 2 of them fail, then we're going back. We have to make another trip out there. We send more samples to the lab. We pay more fees. So by doing a reinspection fee, it's similar to the cost of our service requests for a water sample. That's kind of where I set that price.
And yeah, I mean, the idea would be to We do, because a lot of when we have failing dust wipes, a lot of it is just basic. People haven't cleaned up after the
Yeah.
work well enough. So encouraging them to just clean well the first time and they don't have to see us again.
We do have a slew of, in addition to all of our paint and resources, we do have about 8 or 9 HEPA vacs that we manage and we loan out for free because they are quite expensive. It's not your normal shop vac. It is a HEPA filter that lead dust gets sealed in there and it doesn't get spread around the house.
So, I know we just talked about the lead safe house and relocation of families, but there's like 5,000 properties to do. There's a high probability you could have hundreds of homes that fail, have to remediate. So what are these people gonna do?
So some,
Most of the time we keep families in-house.
yeah.
We do education and cleaning with tenants, families, it doesn't matter. Homeowner occupies their tenants. We're giving them, wet cleaning your house, hand washing. If there is like a particularly bad window or set of windows, we're actually going in and helping them seal that window with plastic and tape so the kids can't access that window. So there's like interim control, we can do temporary interim controls. We can stabilize paint in that short term. And then long term, we want to see that window replaced. We understand not everybody has, thousands and thousands and thousands of dollars to replace every single window at any given time. Again, have already outreached to landlords, tenants. We've sent postcards, hey, this is coming, free inspection period. That free inspection period will be extended until the state says this is the day. So it will be for any rental unit. And we, again, will work with them on that flexible work plan process. That also being said, I'm not sure if this is our last slide with grant funding.
Yeah, that's the last slide.
So this is like the tier 1 smaller, just a visual inspection with dust wipes. We go in, make sure everything's, many of these apartments may have already been remediated and we go in, it's like, oh, wow, this is a slice of heaven. We could take a few XRF shots, do some dust wipes, there's no hazards, and they get their certificate.
So, yeah, the idea of this rental registry program is to work ourselves out of work. Ideally, there's a number of units here.
We have other things that they'll do, Evan, don't worry about it. There's
So
plenty to do.
the certificate is good for 3 years, you said?
Yeah, so we're under the public health law, these properties are required to be inspected every 3 years. And then, there would be some caveats, sort of like at the time of property transfer, those certificates are not transferable to other property owners. So there are some caveats to that. There also are some abilities, say, George owns a duplex and he lives in one unit and rents out the upstairs. Potentially, and we're waiting for the regulations from New York State, but if George is the one occupying his unit, he could potentially sign some kind of waiver saying, I don't need you folks to come in here, it's owner occupied.
So the percentage of homes in Jamestown that were built after 78 is very, very small.
Well, after 78, yeah.
How about homes that are like 100 years old? Was lead paint used like forever
Until 78, it
so-
came off the market,
Yeah, but I didn't know if the
Right.
house was 100 years old, if lead was used.
I don't know when they started putting it in
Yeah,
the
that's where I'm
paint.
going.
Yeah,
Typically, what you see with that is at some point with those 100-year homes, probably around the 50s, 60s, 70s,
Yeah.
they were remodeling something
Yeah.
and using lead-based paint at that. You know what I mean? So
Yeah.
there's some interesting.
in the layers of
Yes.
paint.
Yes,
Yeah.
yeah, I know.
Yeah.
And as you say, this is one thing, but for a while, it wasn't that long ago, involved in a real push about asbestos in some of these homes. So it's
So that's
older
kind of
homes
the
and
same
maintenance
type of
issues. Or-
idea, right? Like there can be asbestos in your home, there can be lead-based paint in your home. But as long as it's not in a deteriorated state, it's not posing hazard.
So some of the idea too, like you were asking about what to do if there's houses full of lead. I mean, there's some things that are relatively simple. I mean, if you've got lead painted floors, maybe you don't need to go without a carpet. Maybe you throw carpets. Maybe you find sort of these creative ways to reduce the risk. It doesn't get rid of the lead, but you can encapsulate it or contain it such that it's not going to create an exposure risk. So, sorry.
Yeah.
Money for fixing things.
Money for fixing things. So, I know, I mean, kind of on topic of concern of federal funding. I am happy to say that we've completed our negotiations for our new HUD lead hazard control grant. Our previous one was for $3 million. This one we applied and were awarded $5.75 million for the next 4 years. So
Low
that's,
income to qualify. I mean, some of these
the HUD,
landlords that might have a bunch of units, I wonder if they qualify for this kind of money.
okay, so I can run through that and
I don't
try to
like the
be.
meeting
I
longer than
know,
the normal meeting.
I'll try to
So
be
start
very
this.
quick about it.
It's gonna be a
but-
30-minute meeting.
I know.
So shut up, buddy.
No, the short answer for that HUD money is it's about the occupants of the home.
Yes.
Okay.
So, yeah.
But the landlords do have the responsibility to make sure that their taxes are up to date. They do have insurance, so and a 3-year lien does go on the property. So say we put $30,000 into a home, into a unit, a $30,000 lien goes on that property, and then over the course of 3 years, if they choose to sell that property, it will decrease by a third each year. So yes, our HUD grant income based off of the tenant's income. Our New York State has actually, with this regulation for rental registry program, they have also allocated $20 million a year that we are able to apply for lead hazard remediation for these units that qualify for rental registry. So our first round, they gave us kind of a set amount of money. We were able to apply for $453,000. We applied for that, we're awarded for that. That money is going out the door this year. My anticipation for the end of this year is subsequently to apply for $1 million every year. That's my crazy plan.
But also just to toot our own horn a little bit, we were able to jump on that HRC money that the state offered because we've already have this established relationship with Chautauqua Opportunities through our through our HUD grants, so that we already have that established, workforce development and contractors to do the work. Some of the other counties that do have communities of concern identified by New York State Department of Health decided not to even take that money because they didn't have any sort of established workflow to get this money out to the community. So we're ahead of the ball on that one.
Yeah, and then, I mean, we did have some American Rescue Plan Act money that was really focused towards homeowner occupied units that already had identified lead poisoned children in them. And we kind of waited to spend this HRC money so we could push all of those properties out the door. And we've completed about 24 units.
It was our county legislator, Marty, in particular, Pierre Shagnon, who really championed earmarking those local ARPA funds to help fill in that gap. So that's, something that we are very appreciative of.
Yeah, and we, there was a little miscommunication about the spending of those dollars. So it came really down to the wire that we needed to get that money out the door and spent. And COI, just our team at COI champion, they rocked bidding so many projects out and managing all of those projects and getting those done for us. So our relationship with them for our HUD in New York State HCR grant will just continue to grow. we're actually hoping to add another staff member there this grant round. So we also do already partner with the city of Jamestown on a Healthy Homes grant through HUD that's set to end probably in October. And hopefully we can reapply for funding for that, but we'll see what happens with federal funding from the end of the year.
So our intention is to share this PowerPoint with you, so you can take it home and digest all of these wonderful things and really look at those numbers and think about those numbers, because ultimately what we're going to be looking at is getting, once New York State has the full regulations, getting something into our sanitary code, and then looking to folks to help us establish a fee schedule for these inspections.
Put them on as an appendix.
Absolutely, yes.
Say the same thing.
Yes.
Yeah, we're
That could
learning the
also
rope.
say that the grant funding gets cut.
Well, and that's
You
absolutely.
don't know, all of a sudden, bang, that's going on.
So, I mean, the good news is where I kind of really want to overachieve in making sure we secure that New York State DOH money is that money's coming from the state. It's not federal funding. This is an initiative of the governor. Like, I don't see that money getting cut. I am an ultimate optimist though. So,
Your fellows just got cut.
Yes,
so.
well, that was federal funding. And again, we're already under contract for at least 4 years for our lead hazard remediation grant. So there won't really, the only one that's we're gonna really maybe see if we can get refunded is that Healthy Homes grant. That Healthy Homes grant allows us to go in and make a lot of other fixes, just that, actually a lot of our applicants for that grant are 62 and up. So we're making homes accessible so people can age in place.
Before we wrap up, I just wanted to end by saying, as you're getting questions about this in the community or talking about this or advocating for it, I think it's important to keep in mind the context here. So clearly from the public health aspect of things, these are big numbers. The, inventory of homes, the amount of renovation work that needs to be done. But, I get to say these things from the public health side of things. An ounce of prevention is worth a pound of cure. And we really do see that in the terms of return on investment in these projects. It's really difficult to, have people in the general public wrap their minds around the cost that this is to families, to the communities, in terms of long-term supplemental services that need to be provided to these children, in terms of our very own early intervention services, pediatric, medical care, transportation, special education.
And special education is huge. I mean,
Yeah.
if you take a look at what it costs to, send a general ed kid, the cost for special education services is twice that amount of money.
Tack on about
And you
that.
never get full remediation.
Right.
I mean, it's always going to be at a loss.
Yes, it's going to be mitigated. And so, about $20,000 extra a year per student, we would, tack on for additional, supportive education. So truly, this is a really wonderful program when it can be implemented properly. There are other downstream trickle down effects that occur just in terms of improving housing in general, overall healthy housing. So that in mind, and then also in mind that this, again, I really don't want the community to view this as another overreach of government coming into homes, because really the intent of this, if we think about it, there are so many upstanding, wonderful property owners, landowners, rental landlords that are local and here in our communities, and they really are providing a great service to our communities. They're going to be the ones that say, help us, absolutely, come in, what can we do? Okay, we'll work with you, we'll find ways to do this. Or they'll let us come in and say, oh, wonderful, there were no issues here. Sign the certificate, we're moving on. What you see when you look in the other communities with programs like this is it really exposes the bad players in the game. It exposes the people who are buying up these property in, land bank auctions and foreclosures and all these things, and doing nothing to flip them and ensure that anything is upgraded in the homes, and pushing people through these properties as commodity. That is investment and important enough for our community at
It'll be
baseline.
huge to address that.
So this is a really wonderful opportunity. And again, just like we talked about on the tobacco sales side of things, it's protective of the business owners who are doing things well. And it really, it exposes those on the other end of that spectrum. So if that's a positive talking point, we can get out into the community. I would appreciate that, Mark.
That's good work.
Well, you've got your 5 most educated board members on this topic. Here.
I really do appreciate your time.
Yeah,
It
this
definitely
was great.
wasn't a 6:30 meeting, but.
Still right at that 8
It was interesting.
It was
It gave us
really
the
super
opportunity to
interesting.
take a deep dive.
Yeah.
We
Sorry.
don't always have.
No, you want
Oh,
to get?
I was just going to try to adjourn the meeting.
Yeah, I was going to do a sidebar after the adjournment.
Can I have a motion to adjourn?
Yes.
Okay.
You don't even wanna do that, right?
Good.
Thanks, everybody.
Yes, sir.
Thanks, everybody.
And so